Hello, and welcome to the Bigg Elimination Tribute Project, Module 6 for Building Provider Capacity for HCV Prevention Program Integration. This module is on cure. My name is Jill Wolf, and I am the Hepatitis C Program Director with the Caring Ambassadors Program. This series was co-created with the Chicago Recovery Alliance, also known as CRA, and has been adapted from a training that we collaborated on in October of 2019. We are grateful to our sponsors for their support. As the name of the program indicates, this project is in honor of Dan Bigg, former Executive Director of the Chicago Recovery Alliance. Dan was instrumental in creating systems for syringe service program and naloxone distribution, was a fierce hepatitis C elimination advocate, known as the godfather of naloxone, a well-known harm reductionist, a good friend of Caring Ambassadors, and it's with his spirit that this training has been developed. The overall project goal is to build the capacity, confidence, and knowledge to integrate responsive Hep C screening, testing, linkage to care and cure, and support programs into your existing infrastructures. We are currently on Module 6, Cure, of 7 modules. Hopefully you have seen each of these others, which has teed you up for Cure, but these are all standalone training sessions as well. The purpose of this module is to inform participants of the true definition of Hep C cure and vital programmatic steps to maximize opportunities for cure. We will be collaborating with Dr. Andrew Aronson, Associate Professor of Medicine at the University of Chicago. He is a hepatologist and a GI physician and will be conducting our echo session for cure. When this module is over, you should be able to identify key program supports to maximize a patient's chance for cure. Should be able to implement meaningful changes to assist in supporting your patients with adherence. As with all of our other modules, we will tee this one up with the spirit of nothing about us without us and hear from a few of our experts.
Knowing what you know, what you would have liked to have known when you found out you were cured of Hep C, what would have been helpful for you?
Not to share straws. That would have been real helpful because mostly that's what I was, I probably have a straw. Can I use your straw? That's it.
Yep.
So I'm not shooting up, so that would have been the only way I could have got it then.
Yep.
This is a huge piece on education. Juanita was someone who has been treated and cured, and in that process was not educated on reinfection, a theme we're going to go through with additional
Some things that I think they bring to the table is a compassionate ear, someone to help build trust and hold our hands through some of the chaos in our lives, and just encourage us. I mean, our lives are in chaos, and that's usually a reason that our drug use is out of control. And really, just focusing, as Dan Bigg said, focus on improvement and rejoice in improvement, and not putting focus on perfection. So,
Luke has some really great insights for what us as healthcare providers can do to support our clients. So we're going to go ahead and get started with Dr. Aronson and his echo style lecture with cure.
So I think probably the most important thing, at least from my perspective, that I want to impart to you guys is that, as probably everybody knows, hepatitis C is curable. So this is not a disease that is, you don't make it dormant or you don't go inactive or anything like that. It turns out that the hepatitis C virus is a pretty wimpy virus, and you can actually completely eradicate it from the body. This is called an SVR, or a sustained virologic response. And the definition of a cure, or SVR, is whatever the course of therapy is, if you measure the viral load 12 weeks following the completion of therapy, so 12 weeks after your last day of therapy, If your viral load is still negative at that time, then the patient is cured, and we count that as a cure. Now, of course, patients can get reinfected, and patients that have risk factors for reinfection is something that we spend a lot of time thinking about and pay a lot of attention to. But as long as they don't have any ongoing risk factors, those folks can be cured. So what happens when a patient is cured? All good things. So as I already mentioned, there is eradication of the virus, but there also are improved clinical outcomes that happen because liver histology improves. That's a fancy way of saying that your liver heals, it gets better. So over time, after somebody is cured of their hep C, in most cases, the fibrosis or the scarring can go away and healthy liver will grow back. And when that happens, you get a lot of really improved clinical outcomes. So you have a decreased chance of the patient decompensating. The chances of the patient developing cancer go way, way down if they have cirrhosis, and all-cause mortality is improved. When we think about what to do when you cure somebody, and I mentioned this a little bit when we talked about staging, if you hopefully get to your patients before they have advanced fibrosis, so if let's say you do your staging workup and they're anywhere from an F0 to F2, that means they have very little fibrosis before you start treatment, and if you cure them, they are done, meaning that they have almost a zero chance of having any significant liver disease unless they have ongoing risk factors. So of course, if they have fatty liver disease or they drink alcohol, then of course they can have ongoing liver damage, but at least from the hep C, it's done. Very, very important, especially if you take care of high-risk populations, that if people have ongoing risk factors for infection, you should keep re-screening them for hep C. So if someone continues to use IV drugs or has any kind of blood transfusions or something like that, that would give them any sort of risk. These are patients that should be screened on a yearly basis at least. Then the flip side is if they have advanced fibrosis, so if they have F3 or F4, so if they have cirrhosis before they get started. Now these are patients that when you cure them, they will have improved clinical outcomes, so the chances of them having decompensation or cancer go way down, but they don't go to zero. So these are folks that actually need ongoing monitoring. These are the people that we screen every 6 months for development of liver cancer. We make sure they don't have esophageal varices. We do some extra things to make sure that they don't have any complications from their liver disease. So what are the tools that we use when we're talking about treatment and cure? A couple things that I want to run through. The first is HCV guidelines. If you're going to take one thing home with you, that is a thing to take home. That is a thing to kind of click through because that goes over all the data, it has it all in one spot, and it goes over all of the recommendations for treatment. The University of Washington Hepatitis C website is a great, great resource. This also has a lot of learning modules on it. This is sponsored by the University of Washington and some help with the CDC. And it also has some of the calculators that I mentioned before of the APRI and the FIB4 to manage staging. And also, a lot of places have cure certifications and acknowledgement. I think this is really important, really as a marker of what the patient has accomplished by achieving a cure. But also, I think it's a really important thing to have these conversations with patients of what does a cure mean, both in the way of all the improved health benefits and really motivating for the patient that all these great things are now possible to happen, that you've been cured, but also in a way to make sure that they understand that there are risks of reinfection and what to do if they do put themselves at risk, and kind of continue some of those harm reduction conversations if they're appropriate. So a lot has changed since 2011 when DAAs first came out. It's really kind of been a crazy and really wonderful revolution of new therapies and new people that we're able to cure. 9-10 years ago, we weren't able to cure most patients that we see. Now it's about 100% response rate in almost every group of patients that we take care of. This includes people with cirrhosis. This includes people with kidney disease. This includes people who are co-infected with HIV. We have had issues with access. These were very expensive medications. I'm happy to say, at least in Illinois, that access restrictions have largely been lifted. So really, anybody can get treatment at this time. So That's been a huge step forward that really able to get patients treatment. And now that treatment has gotten so effective and easy, just as an example, we're even transplanting hepatitis C positive organs into negative recipients because it's so easy to cure, and it's actually increasing our donor pool quite a bit and giving a lot more patients transplanted organs that they really need. So something that wouldn't even been fathomable 10 years ago is something that we're doing pretty commonly now. So lots has changed. All right, I'll stop there.
Thank you, Dr. Aronson. As you've seen, this cure lecture is one of our shortest lectures, which certainly speaks to the fact that someone actually taking the medication, and once they take it, the medication curing someone, that's really our easiest part on this cascade of care. And so the hard part is the prevention and is the getting the medication into someone's hands, which speaks to why this module is shorter than some of the others. Dr. Aronson spoke about Illinois loosening some of our restrictions, and certainly many other states throughout the country are following suit. But one thing that's important for you to know from an advocacy standpoint is that it is illegal to deny someone access to medication because they're not sick enough or sober enough. And so this is something that for many states has been a huge leverage advocacy point to go to their policymakers and decision makers to change some of these erroneous restrictions. So one thing that I want to tee up for you all, which will be something that is accessible to you, is a PSA, a public service announcement that we put together about hepatitis C. This is something that we have found people using in clinic waiting rooms, and we found it to be a really great tool. I'm going to go ahead and play this for you now, and we'll talk a little bit more about it following.
71 million people worldwide are living with chronic hepatitis C right now. It is the largest chronic infectious disease outbreak of our time, and it's curable. Whatever roadblocks you faced in the past, you've been tossed around by the system. You've heard no too many times. You've been told you're not sick enough for the cure. You're not sober enough for the cure. You have to travel to a distant and expensive specialist to prove you deserve the cure. Or maybe you've just been too ashamed to ask. But things have changed. Access to treatment is your right. Many of the restrictions previously facing individuals seeking treatment for their hepatitis C have been abolished. And as of late 2018, the most discriminatory of restrictions have been lifted. Whether you have Medicaid or private insurance, it's easier than ever to qualify for treatment. Don't become another unnecessary victim of a curable disease. You deserve treatment. You have a right to treatment. The time is now. Talk to your doctor about treatment for your hepatitis C, and don't take no for an answer.
So one of the huge pieces about that piece that's really important, and Peter talked a little bit about this, but is some of the provider bias on who should or shouldn't be treated, and what questions are asked. And I think some of the baby boomer population who've been living with this and have seen the evolution of treatment are the ones who really would benefit from hearing a message such as that. So this is available on YouTube. You can absolutely download it and take advantage of this. It's I think touches on some really key points to getting folks cured. So in conclusion, we will be hitting our last module next, Module 7 of Wellness and Support. And that purpose of that module is to identify key program structures that promote wellness, prevent reinfection, and support patients with advanced liver disease. Please don't forget to take your pre- and post-test surveys so that you can get your CEs if you'd like them, or a certificate of completion. One thing that Dr. Aronson spoke about that I do want to point out on our module page under the tools and resources, we will be putting a template for a cure certificate. This is something we've talked to physicians who in their practices set up a process that when someone is cured, they either get to ring a bell or there's an acknowledgement that happens throughout the clinic where everybody signs this certificate who's part of the treatment team and provides that to the patient. And it's been such a really important tool and supportive structure that has been put into place. So just an idea, something it's more feel good, and we'll put a template up there. So please don't forget to access the tools and resources on the module web pages. And as always, feel free to reach out with questions.